has been really an exciting ESTRO 2022 in Copenhagen, finally online and in-person congress with more than 5,000 people from all Europe and not only Europe. And my symposium, my talk in my symposium was on mastectomy, radiation therapy and reconstruction. That's really an important issue for radiation oncologists, but also surgical oncologists, since mastectomy should take into account the effect of post-mastectomy radiation therapy in terms of the improved disease control for high-risk cases. At the same time, the importance to integrate with reconstruction when you have to target and improve health-related quality of life, patient-reported outcomes, the self-perception of patients in order to obtain an optimal integration. So we focus on the timing between radiation therapy and reconstruction, since we have several pros and cons, both using an immediate reconstruction, a delayed reconstruction, and then the types of reconstruction. So we know very well the importance and the critical issues of autologous tissue-based reconstruction and implant-based reconstruction. Again, there are several debated issues. There's not a unique strategy that integrate radiation and reconstruction, but it's really, really important to obtain an expert level in order that there is an homogenization in terms of action. What we can do as radiation oncologists in the setting of breast reconstruction, we discuss a lot on the importance of set up and joining existing clinical trials. At the same time, to properly select the patient that should receive a post-mastectomy radiation therapy in an era where there's really important the integration with drugs and radiation therapy and systemic therapies. Following always the existing delineation guidelines, since both ESTRO and ASTRO perform really exciting and really precise guidelines to contour reconstructive breast, taking in account a volume-based radiation therapy, always choosing the proper delivery technique and following the consensus statements. My talk was the chance to discuss also the recently published European Society for Radiation Oncology Advisory Committee consensus recommendation on dose fractionation for external beam radiation therapy in early breast cancer. That decide some recommendations of whole breast irradiation, nodal irradiation, and fractionation. Basically, moderate hypofractionation can be offered for chest wall irradiation without breast reconstruction, but also for chest wall irradiation regardless of time and type of breast reconstruction. And at the same time, we discuss the new ultra hypofractionation, basically the 26 grain in 5 fractions for chest wall irradiation that should be applied without breast reconstruction, offered as standard of care or within a randomized controlled trial or a prospective registration cohort. And at the same time, for chest wall irradiation, the 26 gray in 5 should be offered within a randomized controlled trial or a prospective registration cohort. So basically, my main conclusions were on 50 gray in 25 fractions, never again in all the setting of postoperative radiation therapy. Of course, 26 gray in 5 fraction schedule can be used as an alternative for breast and chest wall irradiation, but not used as standard of care in case of breast reconstruction. Of course, further publication from prospective cohort studies and randomized trials will be crucial in terms of that setting underrepresented as breast reconstruction and nodal irradiation. At the same time, as a community, we should always try to overcome existing barriers, lack of experience, sometimes inequity, support to change, and reimbursement critical issues in order to help low middle income countries, but also wealthy countries where socio-economic backgrounds and racial disparities unfortunately exist. At the same time, we should always promote a patient-centered approach that is, of course, facilitated in a framework of a national and international consensus statement to promote education, to highlight existing evidence, to provide a sense of community, support, collective impetus for change, and at the same time to open a dialogue about reimbursement at a national and international policy level. So it was really an exciting issue, and a lot of things should come.